book a program. And this new entrant is not new to the game. Quite experienced, has been there, seen that. And based on that experience, they're able to project where the future is heading. And with that said, them coming into a Booker program and hopefully to be listed soonest, it will be quite an honor for them and also for the market, because issues marketing deepening is quite a discussion that we've had on this show and many other platforms out there. Well, ladies and gentlemen, today I'm honored to be joined by the one and only Dr. Kanyenje Gakombe, who is the founder and executive director of Metropolitan Health Services Limited. Sir, thank you very much for joining us.
Thank you.
This is not your first interaction with the stock exchange. Actually, it goes back in the early years, even before the formation of this company. In 1991, you interned at the stock exchange.
That's correct. I was a medical student who was interested in investment because I knew one of the directors of the stock exchange, one of the stock owners of a stockbroking firm. And I asked him to offer me a holiday job. And he offered me a job at the Nairobi Stock Exchange. So I was among the first 3 employees of the exchange. So I worked for the exchange for 3 months, then worked for a stockbroking firm for 1 year because the University of Nairobi went on strike and we needed to find stuff to do. So I worked as a stockbroker. I was trained as a dealer. I actually have a certificate, among the first certificates of trainees for dealers on the Nairobi Stock Exchange.
Wow. And that laid the foundation in terms of understanding the market and what it offers?
Yes, it did, because on a day-to-day basis, I was fortunate that my employer, in a sense, made me his PA and taught me everything he knew. Lawrence Sutcliffe of Francis Drummond Stockbrokers. So I got to meet clients, I got to trade in the way trading happened then as a dealer. I got to review balance sheets of companies and write reports and make presentations. So in a year's time, I knew quite a bit. And it's actually in one of those interactions that I met the person who became Metropolitan's angel investor, Mr. Ankram Evans, who was a British citizen who had invested his army pension in Kenya and was then a director of City Trust. Or it used to be called City Brewery. It's a company that became City Trust. And so when because he was our client and his father was a doctor, he was very interested in what I was doing. And he provided a lot of the funding that we used to set up Metropolitan Health Services.
Mm-hmm. Definitely.
So a lot of what we've done has something to do with those days in the stock exchange.
Yeah, definitely. And that is quite a rich foundation because you are coming from a professional background of being a doctor, and also you're inculcating this business angle of it. And that brings us to Metropolitan Health Services in its initial days. What was the motivation of coming into this sector?
The biggest was that in the early 90s, Kenya was going through what were known as the structural adjustment programs. The economy was in a very bad place. Medicines were not available to patients. The healthcare system was overwhelmed. And as I was then a medical student, and as we are training, we were acutely aware that we were going to work in a very, very difficult environment if we stayed in the public service. And we began to ask the question, what shall we do with our skills? And we thought the best thing was to take control of our destiny, leave the public service, and set up a healthcare facility where we could offer an alternative healthcare provider that was more affordable, but at the same time providing a good quality of service. If you look at where Kenyatta National Hospital is, it overlooks Nairobi Hospital. Mm-hmm. So at that time, those who had the financial resources would be able to access Nairobi Hospital. Mm-hmm. Those who didn't were to a bed in Kenyatta. And despite the valiant efforts that the people in Kenyatta were making, it's difficult to give quality healthcare when the system is overloaded. It doesn't matter who you are. As long as the system is overloaded, quality gets compromised. So the vision we had was to set up a hospital that in a sense would sit on Gong Road. You know? Quality as close to Nairobi hospitals as possible, price as close to Kenyatta's as possible. So that's where Metropolitan has tried to sit all these years. Provide quality healthcare and try to innovate and keep it affordable to the middle class. Clearly, there is a population that private healthcare can't look after, which is a population that cannot afford to pay at all, because private healthcare depends on patient fees to pay staff, to buy medicines, to equip and everything else. So you need people who can afford to pay. But there are also people who strain a lot to access the leading healthcare facilities or the older ones, because their prices are significantly higher. So we were targeting to provide to the middle class. And our going to Buruburu was very, very deliberate, because a lot of the middle class and the lower middle class live to the east of the city. We were also trying to address a historical problem. The east, which is where Nairobi was expanding to, had no healthcare facilities because none of those populations had put up a facility there. So we were attempting to solve that problem. So our location had everything to do with the population we are targeting. And since then, a lot of other providers have followed us into the east. You know, the Mater Hospital came, AR is there, the other healthcare facilities that have come up. But before then, there was really no significant private healthcare provider in Eastern Nairobi. Even public, Mama Lucy was built after we started. It's newer than Metropolitan. There was really no healthcare facility worth its name in Eastern Nairobi before us. People had to cross over to go to Kenyatta. They had to cross over to go and have a baby in Pumwani. They had to cross over to Aga Khan or Nairobi if they could afford those private facilities.
So there was a lacuna.
There was a gap.
Wow.
And that's a gap we sought to fill. And that's a gap we are still working to fill by building what we call a healthcare hub, which is a hospital with all the ancillary and supportive infrastructure that it needs. The doctors, the equipment, the staff, because a healthcare facility is more than infrastructure. If you have the infrastructure but no doctors, the infrastructure but no nurses, then you do not have a facility. And you may have seen with the equipment program for the public facilities that in certain places the equipment was bought. That's usually the easier thing, expensive as it is. The equipment was bought, but the people were not available. So ICUs could not be set up because the nurses with the training were not available and the doctors were not available. So our intention and our plan in Eastlands was not only to put up the hospital, but to attract healthcare talent to work and live there. So along the way, we actually built a 34-bed estate called Metro Villas Estate, which has houses as good as Kilimani townhouses, just next to the hospital, actually connected by a door like that one.
Oh,
yes.
So it's a holistic approach.
It's an ecosystem.
Wow.
Yes.
And that brings me to the issue of investing in healthcare.
Yes.
Because you've been very intentional. You're saying you're an ecosystem. You're creating an ecosystem.
Right.
Kenyan healthcare, has there been a deliberate effort to invest? Because you're doing your bit, but on a larger scale as a practitioner in the industry. Has there been the channeling and pumping of money to make sure that the system itself is set to cater for the whole country in a better way?
It's better now. It was a lot worse in the past. You see, at independence, Kenya did do a sessional paper in 1965 and said we'll sort out education, we'll sort out healthcare, disease, ignorance, and poverty. That was always the national objective, and it continues to be the national objective. The challenge is in the details and the how. So the government supported faith-based facilities with staff because they're the ones that were already spread out across the country. The government also provided teachers to schools that were originally started by missionaries. You know, whether it's Maseno or Mangu High School where I studied, or Chogoria, they usually would have a church, a school, and a healthcare facility, or alliance in Kikuyu. So the first step was to expand reach, was to support the schools and support the faith-based hospitals. But that could only take us so far, because it still depended on government resources, and it depended on missionaries to continue to set up additional infrastructure. So with the dependence came responsibility. The missionaries were no longer evangelizing as much, so building additional healthcare infrastructure sort of stalled. So if you look at many faith-based hospitals, they date back to the early 1900s.
Yes.
Some are 100 years old. There are not too many that were being set up after 1980. Secondly, the government faced challenges in the 1980s especially, so it had no money to invest in healthcare. So the gap now became bigger. We have a growing population, because if there is one thing we do fairly quite well, it is getting the next generation of Kenyans.
Yes.
And these young people need maternity places to be born, they need healthcare. So we were basically increasing our population at a faster rate than we could provide social services. So we needed a new player in the space. And that new player was going to be a private for-profit, an investor who was going to find the resources to put in healthcare and be able to earn a return. And that took some time. We are among the pioneers. But since us, you know, the Nairobi women followed about 6 years after us, and there are now quite a number of private for-profit healthcare facilities that have been put up by investors.